So Michelle and I are going to talk about the nuts and bolts of growing and sustaining DEU partnerships, and also about the orientation that we do for the nurses, the bedside nurses at the hospitals. Our role, Michele McKay is the clinical coordinator. She does everything clinical. She is the glue that holds all of us together, because she makes the site visits, she makes contact with the managers, she talks to the students, she talks to our clinical faculty. She's always looking for potential sites, specialty areas, different nursing units, different areas, setting up all the clinicals for all of the students, and making sure that we have everything, or the students have everything they need to go to that certain facility, and that our clinical faculty from UB are up to everything too, like our PPDs and our BLS and all that sort of thing. So she's got a really huge job. And the site visits, both of us try to make site visits. Michele does a lot better job than I do. And me, I do the site visits. I oversee the faculty. So if there's any issues with faculty, I'll usually go to that site or have the faculty come in and we'll discuss what's going on. I also have, well, Michele does too, but if there's a problem with a student, we set up a contract, and the contract is, how can you improve your performance in the clinical area? And we'll sit down with the student and the faculty and find out what is the actual problem with that. And then most importantly, we do the DEU orientation for the nurses in the hospitals. We also do, we take our education on the road. We were at Kemmer Mercy not too long ago, where sometimes it's hard for the nurses to get to UB and listen to the DEU orientation for 4 hours. So we do go to sites, but it's nice when they do come here, because there's other hospitals. They can really network, talk to each other about issues that they've been having maybe with the DEU or teaching students. The role of the nurse manager is so important, and especially in regards to the DEU orientation, scheduling their nurses for the DEU orientation is so important. Being able to get them off that unit, off the floor for those few hours to get the education that they need to help them know how to teach. They have to pick the CIs, the clinical instructors, the preceptors, the DEU nurses. They choose them, by their experience, how engaged they are with students, and the faculty or the bedside nurses that I have seen in the DEUs, they're just wonderful. But like Karen said, they love what they do. It gives them, they're reinvigorated, with nursing again and learning again, and they really, really do enjoy it. So it's important for the nurse manager to pick the right people for the CIs. Value the CI. It's a lot of work. And when Karen said $5 an hour, I'm thinking that's $60. I mean, we're paying $1 an hour for preceptor. It's a lot of work, and I think that they need to be valued and more, not just by financially, but we need to really bring them up in our units and really recognize them for what they do. We do evidence-based projects, okay? It's really important for the nurse manager and the nurses on the unit to be involved in what kind of project are you looking for? Something with value-based purchasing, a problem with Joint Commission, anything that you need to do to improve your HCAHPS, patient satisfaction, product evaluation, anything like that, to give us ideas of what the students can do to help your unit. It's for you. Communicating with the clinical coordinator, and then collaboration with IT. We're always struggling with passwords, making sure that everybody's got the, all the passwords in check. That's a big headache, I know, for Michele, but that's something that we have to work on together.
Part of the process. Okay. Can you guys hear me okay? Okay. So I was worried this morning when I started this that, hang on a minute. I do this every time in this room. I was worried this morning that I wouldn't have enough to talk about, and then as other people went on, I thought, oh, I could add this there and add that there. So I'll try not to go over. Some of what I'm going to talk about too comes from our orientation we do with the CIs that are identified, and we do that twice a semester, or excuse me, twice a year, once at the beginning of each semester. And we look at the role of the UB faculty as in these DEU units. And I have a funny little slide later that I'll share. But really, when I started as a clinical instructor, I was on a traditional model and I had 10 students. And I just remember I'd be in a room and a student would be struggling with something. So I'd be doing that one-on-one and I'd come out and there'd be 5 students in line waiting for me. I need to do this, I need to do this, I need to do that. And you would just sit there and I'd get some pushback from nurses that, you know, oh, well, you know, you're the instructor, you're getting paid for this. And I can't tell you how much I embrace this DEU model now because we don't have that, you know. So I thank everyone here that does have DEU models and hope we can grow more, because it really does help develop these students into the nurses we want them to be, because when they're at clinical, their time is always put to use. They're not sitting around waiting for an instructor. And so as we move the faculty into this role as instructors on these DEU units, it's like, you know, they kind of look at, what do I need to do? We just moved one of our faculty who is a full-time member of the UB School of Nursing into a DEU role, faculty role this semester. It's her first time she's ever done that. And she's been texting me a lot. She's like, I'm not sure what to do. And so I go through all of this with her, you know. Of course, they prepare students for the area and give the students information, but they really work with the CIs. And that is really the role of that faculty now, working with those nurses that are taking our students, preceptors, DEU nurses, everybody calls them something a little different, and making sure that, you know, the student and the nurse are a good fit, because sometimes we know that's not going to happen. Sometimes we do move students. We think, well, this student will work better with this nurse. And there's a way we try to look at that in the beginning. I'll show you an example of how we set some of that up. Assignment of patients if a CI is not available. That's huge. And that's one thing we really push at UB. If you get to that unit that day and for whatever reason, somebody's absent, you know, things happen in everybody's lives. We may not have enough nurses to take our students that day. Our clinical faculty is expected to go back to the more traditional model and take a couple students with them that day then. They're doing the more traditional role where they assign the students a patient that the student, you know, stays with for the day, and the CI, the clinical faculty, excuse me, will work with the student then in the care and deliver, passing meds, any skills and procedures that need to be done. Absolutely, and maintaining safety is important for the UB faculty. I can't tell you how many times when I make clinical visits and I walk on a floor, I'll see a little something. I'll say to the CI, did you, or the nurse, clinical faculty, did you notice that? I was on a floor one day and, you know, the classic, I watched one of our students walk out of a patient's room with their gloves on into the hall to go to the linen cart. You know, that's all our huge, like, no. And I'm like, wait a minute, hang on, you know, and talk to them about that. So those are things that, you know, the faculty is constantly should be rounding the unit and, or units. We have faculty that are sometimes have DEUs on more than one unit. They may have 4 students on one, 2 on another. I know Kenmore Mercy, we have that. So they're on more than one unit. So they're constantly rounding and making sure these things are getting done. Making sure that the students are meeting course objectives and being aware of those, and helping the CI understand what those objectives are. And all of our DEU nurses are very good. You know, what year are they? What have they learned? And they'll ask these questions, but making sure that the clinical faculty reinforces those. Open communication, as long as we're there and engaged, it should be good. Students learning and meeting objectives, and providing formal and informal evaluations. We do want the CIs to help us with that on these DEUs. All of us from academia know we have end of course evaluations for our students, or end of rotation. How did the student do? Did they meet their outcomes and objectives? And the CI is part of that. Some of our faculty actually have formal sheets that they'll give to the CI each day, and they'll say these are objectives for the day or for the rotation, and they'll meet with the CI each day. How is this student doing on these? Is there anything I can help you with for the student to meet these? And then the CIs help complete formal evaluations at the end of the rotation also. And mentoring CIs in the role of that instructor. You know, most of them are, you know, we do like them at the baccalaureate level, but they're not. We do have ADNs that are our CIs, but they're that identified as that great caregiver, that great nurse that, you know, as Karen outlined, you know, that person that exemplifies what we want our graduates to be. So they will, they may need some help asking those questions, and I'll make rounds on the units. I go to all of our units at least once or twice a semester, see how things are going. And I'll note sometimes, you know, we'll have a senior student on a unit and the CI is still, you know, telling the student everything they're going to be doing. And, you know, I'll say to our clinical faculty, you need to pull that CI aside. You need to say to them, you know, you're doing a great job, but you need to be asking the students more of those questions than telling them what they're doing, because we want to promote and develop those clinical judgment, clinical reasoning, and critical thinking skills. Question? Yes, our students start out in DEUs from their first clinical. They'll be on a DEU, and we will tell those nurses that, those CIs, this is their first time in a hospital. It just happened a couple weeks ago. Our juniors just went out. They spend the first few weeks in lab and they went out, and, you know, we very much, that's the clinical faculty's role to let these CIs know this is their first time. And I said to one of the faculty, you know, how's it going? And did you spend a little time orienting? And she goes, yep. And then I got them right out there, because a lot of them just need to shadow and see what that role is for the day. And so the first day, they may be more just following the nurse around, seeing what they do. And then we want to see them more engaged, of course, as the semester progresses. Sorry. We do have some of our instructors. It just depends on the instructor. Some of the instructors will give them a formal evaluation to ask them to complete. Other ones do just a verbal back and forth of comments. I think, you know, we provide a little bit of, I don't want to call it academic freedom, but for lack of a better term right now, for our clinical faculty too. So that's up to them. If they want to use a more formal evaluation with the CIs, they can, for the students, they can do that. I know some faculty will give them a sheet every day that says, this is what I want you to work on with the student today. Other ones will do it verbally. So it just depends. So we give them a little freedom there. But, you know, I think institution specific to of what you want to do, you know, what works best for you. We do have DEU binders that we leave on all the units, and this came up from our feedback with our agencies and our units that said, boy, we'd like to know a little more about what's going on in this course. So we try to give this to them ahead of time, and I left the binder back there. It's next to Ellen. Yes, thank you. So you can pass it around, Ellen, take a look at it. You've probably seen it. But what we have in our binder is some of the things that Kathy was just talking about. Of course, we start with our faculty contact information. We want anybody on the unit to know, and I always I set these up and I make sure with our clinical faculty, which are usually fine with it, I give them your cell number. Because as I said, some of our faculty have students spread over 2 up to 3 units. So that way, if there's any issues, the nurses can get a hold of the instructor right away, or the faculty. Of course, we have DEU instructions in there. We look at our mission and values so that they know what makes, you know, UB different from DUville, Niagara, our other nursing programs in the area, what everybody's expected roles are, faculty, the CIs, and the students. We have some giving feedback hints because, as Sabrina just mentioned, sometimes those nurses are not comfortable right away. And that's why we bring them in for orientation too, to help develop some of their feedback skills. How do you give a student feedback? And we're going to go through that later this morning. and then some strategies to promote that critical thinking, which I just said is asking the students the right questions versus giving them all the information. Course information is in there. We always put our current syllabus, which does list our objectives for the course of what the students need to accomplish. We have course assignment sheets. What are the students' required clinical activities for that semester? You know, do they need to do a project? Do they need to do a teaching plan? Do they need to complete a concept map? You know, what is their assignments while they're in that course? And then we have student information sheets too, and I'll look at those in a little more depth in just a second. We put our policies in there. Our dress code policy is in there. We've got things about injury, needle stick, other injuries, and you know, basically it kind of gives the CI some idea of how to proceed if something did happen. And we have one of our incident report forms in there too, because like everybody, when something happens, they not only have to fill something out for the agency, but something for us also. So this is just an example of some of the information we have on our student data sheets. We ask the students to complete these before the semester starts. And that way they go to the clinical faculty, and then the clinical faculty can get them to the unit and work with the nurse manager or the charge nurse to determine which nurses would work best with each of the students. So it looks at prior work experience, their goals, you know, things that they're excited, nervous about, what they might want the nurse to know about them that's not explained in the first four. How do they learn? What are their strengths, their weaknesses? Looking at responsibilities outside of school too, because sometimes we think, even in a four-year institution, that this is their main life, being in school, but it's not. It's amazing what everything that some of these students are doing nowadays, juggling family and jobs and a lot of other responsibilities. How would they like to be corrected on a mistake? And we talk about that in our orientation with our CIs also. You need to set something up with a student. How does that student want you to stop them? If they're in the middle of something, you're like, holy cow, if they keep going, this is not gonna go well. So is it, you know, a word clue? Is it a gentle, you know, place your hand on their arm? So we like them to work on that. And anything else they should know about them, especially illness. You know, if you have a student that experiences low blood sugar or has any type of dizzy spells or anything, we do want them to let the CIs know that. We modify it a little bit for our specialty settings. This is an example of one that we've used in hospice. So looking at their background, we do have both, especially in our senior year, we have both traditional RN and then our accelerated program, and they meld together in the senior year. So it's nice for the CIs to know, is this a ABS student that has a first degree in something else, or is this our traditional student? Why they pick nursing, and then why hospice? Because when we put our students in a specialty setting, we do ask, they do have to apply for those. And we have a process we go through that we select them for the specialty setting. But why did they want to do this setting? Again, the role of the CI preceptor, working with up to 2 students, collaborating with the faculty, detailed on the students' daily sheets. So as I said, some faculty will give the CI a daily sheet that says, this is what I want them to work on today. Or some of them have the students do that too. They'll say, here's a daily sheet. What do you want to work on today? Let your CI know. Again, guided by course objectives, and identified too that it shouldn't be the CI and the clinical instructor or clinical faculty need to look at what the student wants to work on too and make sure it's meeting the objectives. You know, some of our students get a little zealous too, and they're like, no, you're not ready for that yet, but this is what you need to get done now. Students' limitations. We know patients safety is priority in our program, and we want the students supervised when they're doing things, especially until that CI feels comfortable in what they're doing. So oral med passes, you know, are they following all the rights of medication administration, other procedures, and performance feedback is so important, both positive and if there's things that need correcting, every day to students and faculty, letting them know. And it's like when you're writing evaluations too, oh, you did good. Well, what does that mean? You know, or when the students write on their assignments, oh, the patient's good. Well, what does that mean? So really digging in, you know, are they prioritizing? Are they organizing? How are their clinical judgment skills progressing? Are they asking, you know, appropriate questions that you think for the level that they're at too? We sometimes have a little gap in the summer with our traditional students where they, you know, ended clinical in April and now they're not coming back to clinical to September. How are their skills? Are they up to where you think they should be as beginning senior? Do we need to get them back into our lab to practice some things too? So these are things that the CI and the faculty should be talking about too. And the faculty should be helping the CI, and the faculty come back to us a lot too, to myself or Donna as the coordinators. You know, I'm having this problem. How can we work on this? Is there something I can do to help the student be successful? And, you know, that's the goal, make them all successful. And we do, you know, we have high standards at UB, and we tell our students that from day one, and we hold them accountable, but, you know, they need to come prepared to clinical, and they have to be engaged. They have to be responsible for their learning too, you know, and maintain that communication with that whole team. We're huge on interprofessional collaboration here at UB, and we work a lot on that through a lot of different activities outside the clinical setting, and we expect them to then take that to clinical and be able to work with that team. They need to know what their CI, their DEU nurse, expects of them each day. Absolutely acting professionally in dress and manner. And we tell them all the time, you know, you're on a job interview. Every time you go to clinical, you're on a job interview. Everybody's watching you. Everybody's paying attention to you. They are watching everything you're doing, and they're deciding whether or not you might be somebody that they want on this unit and want to work with. And similarly, you should be looking at units also and thinking, is that, you know, a unit that you think you would work well on when you graduate? Could you see yourself there? Complying with policies, asking for help or supervision. And we tell them all the time, you know, we're very upfront and honest. Years of nursing, I said, I still walk in sometimes and I'm like, oh, haven't seen this piece of equipment before. What are we using this for now? Oh, this is our new, you know, whatever. And it's like, oh, concepts are the same, but you got to learn how to use new pumps all the time, right? Concepts are the same, but you got to figure out how this one works. Making sure their written assignments are done and submitted on time, and then promotion of that evidence-based nursing project. And they should be looking for those things too, because they're in classes and they're hearing and seeing different things, and they should be looking for those things on the units also and seeing whether what they're learning in class is what they're seeing in practice. At the end of every rotation or semester, we do DEU debriefings, try to meet with the CIs, the students, and the nurse managers to see how things are going. I try to set those up in the beginning of the semester and have dates so that we can meet. Usually try to do them very formally. And again, it requires a lot of honesty and feedback, constructive criticism. We get things out of it that we need to be doing better. The CIs get things out of it that they might want to do better, in the unit managers too. And we've had students say to the unit managers, hey, we investigated this, we learned this in class. This is something that maybe you could use on this unit that might be helpful. And we've had unit managers do it from the simple, you know, cushioning for people on long-term oxygen so they don't get the skin breakdown over their ears and things like that. So our students are we want them to be on top of these things and look at, you know, the evidence-based and what's out there. It can help help the patients. That's our number one priority. And looking at goals and needs for future semesters, we, you know, example 2 is I was at one DEU debriefing, and one of the nurses, and this was the CIs, had a student first semester, this is the first semester junior debriefing, and the student left, and then the manager and the nurses were talking, and the one nurse said, well, you know, that student's really quiet, but, you know, I think that'll get better. And I looked at the CI and I go, well, did you tell the student that? And they're like, oh no, I could never tell the student that. I'm like, and that's where I came in my role and said, but that's what we want you to do as a CI. You know, how could you tell the student that? You know, we did a little role play because it is important. And I tell CIs, just like we tell clinical faculty, if you think something's an issue, don't wait and think, well, you know, it's only their first semester. They'll get it by next semester. If it's still a problem, we need to address it, because we all know that are in education, it doesn't end. You know, if it's not brought to their attention, then we can't correct it and make it better. So that's part of our debriefing and what we look at, and we set up goals for next semester. Some of the things we've found out also is how much in advance these agencies need our semester schedules, because their schedules go out for their nurses so they can plan to when to have CIs on the units. So those are things we found through our DEU debriefings also. We also do evaluations along with the debriefing, sometimes there's just a few things that maybe they're not comfortable saying in debriefings. So we have a online survey they can do, and I'm gonna show you this. We have one for our CIs. It's a Google Doc. So we'll send each CI the link through their agency email. And they just put in their name, their student's name, where they work, their unit, you know, our basic demographics, their years of experience, and some of the questions we ask. Do you feel this enriched your professional growth? And we had done some informal ones on paper, but we've made this a much more formal process. And things I hear all the time are, I love having a student because it keeps me current. I can't tell you how many times we get that on our DEU CI preceptor evaluations. We get ones too, like I like working with students because I remember what it felt like being a student. And I can't tell you our DEU relationships, how much our faculty even said. We just put a new faculty on one of our DEU units, and she says, oh my God, they just came and grabbed the students. I didn't have to beg anybody to take them. And it was a wonderful experience. And I would like to see that on every unit. You know, it's just a wonderful thing, because as a student, you just feel like, wow, people want to help me learn and grow. Other things on the evaluation for improving the experience, and would they participate in the future to be a DEU? And, you know, once in a while they'll tell us, no, I've got too much going on, or I need a break. I just need a break for a little bit. Because as we said, it is a lot of hard work. You've got 2 students with you, you're managing your patient load, and you're trying to help these 2 students grow into a future nurse too. So it can be a little bit much for some people every semester. And we have one for the students too. Pretty similar, where they were, but asking them about their preceptor. Did they provide a professional model? Please explain your answer. So it's interesting what sometimes some of our students think professional is. Would you recommend this placement for others, and why? Any suggestions to improvement? So they're short. We're not asking them, you know, we tell them they're only going to take you a couple minutes. We don't want to overwhelm them. We don't want to make them so long that they don't want to do them, but just quick information that we need. So one thing I do really enforce in our faculty, and we all do that work on DEU units, is that DEU does not mean D, drop, E, exit, unit, U. It does not mean drop and exit unit. We expect our clinical faculty to be there. We expect them to be engaged with the students, engaged with the CIs, touching base with the unit manager, hopefully every week. But if not, at least every other week, so that they, you know, because we're a partnership. It's not our students and the nurses, it's the faculty too. Well, it's amazing sometimes when I started in this role at UB a couple years ago, and that's what I was hearing from some of our DEU. We never see your clinical faculty. Where are they? Awesome. And I will have managers who come up once in a while, not very often anymore, but you know, I think part of my role as a clinical coordinator is getting out there and just making visits, and I don't tell people when I'm coming, and I think, you know, it's very much, but when I first started, there were a few managers who said, I never see the faculty, I don't know where they are. And again, another responsibility of our clinical faculty is engaging with those CIs, but looking for other people that are interested in teaching. And sometimes, you know, they will go on a unit, and it depends what agency we're in, but sometimes there might not be enough CIs that day, and a nurse will say, well, I would love to do this. Could I just take a patient or take a student for the day? That depends on your agency, depends on your policy in your institution, but sometimes it does happen. Or we'll look at some of those and you'll say, you know, I'm sorry, you can't because you haven't been through our orientation, or your agency won't allow that. But that's too where we say to the CI, you need to talk to the nurse manager about that person and tell them they're interested. And, you know, they may be showing the student something, you know, just off to the side, but maybe not take the student that day. But there's a real, we want everybody to be a teacher, but we know not all nurses want to be. Role model for the excitement of teaching to the CIs, and identifying, again, staff nurses that are interested in teaching. The clinical faculty that's assigned to the site, yeah, they're expected to be there all day, that their students are there, absolutely. Now, it's a little different for some of our home care sites. Linda, how do you manage it? Because she's in hospice, and we have students both in home and at the hospice.